Okay. So this is Pitt Public Health. This is the building we're all in. The second picture is myself at graduation. I finished in 2006, but I participated in the 2007 graduation, and at the time that was the speaker. The third picture is my dissertation advisor, Stephen Thomas, who was on faculty here, who's now in Maryland, and if it weren't for him, I wouldn't be standing here today. He gave me that courage and that inspiration to continue. You see the convocation booklets, and then in 2007 at the alumni dinner I received a dissertation award, which I never thought I would, because I didn't really think my dissertation, I knew it was good, but I didn't think it was that good, so I was really happy for that. And then in 2016 I received a Delta Omega award, an alumni award, so there I am with Dean Burke. So fast forward to Highmark. You see the Highmark building, which is located downtown Pittsburgh. And then these other two pictures are a view from my window. So where I sit, I can overlook Market Square. I can see one of the rivers. I can see Station Square. So that's where I sit. That's my perspective every day. So when I get a little bored or I feel like I need a break, I just stare out my window. And Market Square used to be a real hubbub of activity, but now it's pretty quiet, so I enjoy looking out my window. Okay, so you might be wondering how a degree from Pitt Public Health really informed philanthropy. I didn't think it would, but it does. All of the skills that I learned here at Pitt Public Health, program evaluation, survey design, policy analysis, program development, all helped me when I first went to Highmark in my career as I developed health education programs for Highmark members to what I'm doing now, which is grant making. I'm currently the Senior Program Officer for Highmark Foundation. Now, I work for Highmark, but I'm a loan service through the foundation. The Highmark itself is a health insurance company, but has broadened over the years and now owns a health network called Allegheny Health Network, which consists of 8 hospitals, 7 in Western Pennsylvania and then a hospital in New York. Highmark also has for-profit businesses in vision, dental, and stop-loss insurance. So I work for the insurance company, which is Highmark. The Highmark Foundation is a nonprofit affiliate of Highmark. All of our funding comes from our parent corporation, which is Highmark. So we don't have to look for money. We're given money every year. Every year, the Highmark Foundation distributes about $3 million in grants to Pennsylvania and West Virginia. The Highmark Foundation was created in the year 2000, and the foundation funds organizations, nonprofit charitable organizations such as schools, churches, community-based health centers, and government agencies to help them build capacity to offer programs to underserved and underinsured and uninsured individuals that need it the most. I always say that any given day I could be in any county anywhere, because my territory is 28 counties in Western Pennsylvania and then either 54 or 55 counties in the state of West Virginia. So I usually log a lot of miles along the way. The foundation programs, they do impact communities. At least we like to think that communities are taking advantage. We always encourage nonprofits that meet the eligibility criteria to apply for funding. We know that one foundation can't fund every program, so a lot of times the Highmark Foundation will partner with other local and sometimes regional foundations. It gives greater impact and greater dollars, and it allows that organization to reach more people. So the Highmark Foundation has 3 funding priority areas: chronic disease, family health, and service delivery systems. So for example, chronic disease would be those programs in which cancer, diabetes, heart disease. So we're looking for programmatic, evidence-based programs that we can fund that have a beginning and an end. So we're looking for programs that will have a pre-test, a post-test, or some pre- and post measures so that we can report to our board that these programs are effective and that's a good use of Highmark Foundation funds. Family health program, we improve family health through programs such as HPV vaccination toolkit for adolescents. We've funded programs, oral health for veterans, and physical fitness and nutrition for underserved communities, being adults and children. And a lot of times we will engage a certified fitness trainer who will come into a community and work with underserved individuals to help them get their physical health back on track, because we know that if you're not healthy, you're not able to work and you're not able to be productive. So that is one way that we help organizations and we help communities, is to get back on track. Service delivery systems provides uninsured individuals with improved access and greater access actually to programs that they would not be able to access on their own. Now, the foundation does not fund programs for people that are insured. Now, Medicaid and Medicare are publicly insured programs, but for example, if you're commercially insured, would not be eligible for our programs. People that are insured do have insurance. They may not take advantage of it, but they do have it. So we work with organizations that work with clients that don't have any insurance, or they're not able to access those programs that they need to improve their health. Service delivery system programs could be, and these are programs that I have worked on, as medical respite for homeless women, integrating health into community development or economic development, which is really exciting because it's taking an organization out of its core competency. So usually economic development corporations are about beautifying neighborhoods. They're planting trees, they're upgrading storefronts or fronts of buildings. So we went to them and said, if you had a grant for health, what would you be able to do? So right now I'm working with two grantees actually that can potentially change health outcomes in their communities with a Highmark Foundation grant. They receive grants of $100,000 each for 1 year to really impact change and really bring people to good health in their communities. So those programs haven't continued yet, but we're waiting to see exactly what those programs would be able to do and the effect on the community itself. So we look at grant making from different lenses. First is from a public health perspective. So we're interested in impacting the health of a population, not an individual, but a population, a neighborhood, a community, how those individuals work together, how they live, how they play. So it's about looking at the social determinants of health and how through grant making we can make a big impact. We look at system change. Again, it's access to quality programs, not just programs, but quality programs, programs that are going to make a difference. We look at thought leadership. Highmark Foundation likes to be on the forefront of many public health trends. So, for example, our bullying prevention initiatives and obesity prevention initiatives are recognized world-round. That falls in our family health category. Those are two programs that we still continue today and that we receive requests, pretty many requests for our obesity programs. Our chronic disease programs are about 43% of our funded programs, and then the other would be our family health and our service delivery systems. So this slide here that you see, I did put up a little early, are programs that I have worked on. I develop all of the content for requests for proposals that the foundation issues. So in 2016, we issued two RFPs. One was for health departments, and that's strengthening health departments, and that was helping them with most of the health departments. There were 6 of them were seeking accreditation, so we helped them to be able to do that. The second was empowering and encouraging communities for HIV, AIDS, and STDs. So we funded about 10 organizations throughout Pennsylvania and West Virginia to work with their clients to expand their HIV, AIDS, and STD services. Those reports are just coming in, and the Highmark Foundation will be releasing a paper on the outcomes from those particular grants. On my right side, you see 3 postcards. We work with the Pittsburgh Post-Gazette. We fund a series of health forums. This is our 3rd year of those forums, and they're all connected or aligned with our 3 funding priority areas. The postcard on the bottom was an HPV forum that the Highmark Foundation hosted in West Virginia, and the purpose of that forum was to educate a different variety of audiences on HPV, try to eliminate some of the barriers, and talk about the importance of HPV vaccination to prevent cancers later in life. And so that was successfully attended. So my responsibilities as a grant maker or in philanthropy would be from the time the proposal is received, I'm vetting the proposal, I'm reviewing it to make sure it meets our guidelines. I'm looking at the budget, I'm monitoring the budget, I'm monitoring the guidelines. I conduct site visits with each grantee at least once or twice to make sure that the program is on track, and again, reporting outcomes to our board, showing them that our programming and our funding has been effective. Because if our board doesn't agree that our program is effective, then we may not receive funding for the next year, but that never happens. We're always funded by the corporation. Okay, so this slide shows that these are programs that I have worked on. The first slide, it was an oral health for veterans. That was in West Virginia. The second slide, where you see the children, I work with a faith-based collaborative, and we had given money to churches for Children's Grief Awareness Day. So I attended a church service, and the children were performing some type of dance during that particular service. The third photo shows community health, a physical activity and nutrition program where different communities competed against each other for a cash prize of $2,500. And we had this is the winner of the $2,500. The slide on the bottom was from a free clinic in Johnstown. It was called War for Health. And there are high rates of diabetes, hypertension, and heart disease in Johnstown. So this particular clinic declared a war on health. The play for War on Health was that they worked with the United States Army. It was a medical corps who conducted the screenings for this particular project. The project in the middle was for EMS. It was health and wellness screenings. We know that EMS providers take care of everyone else, but they don't take care of themselves. So you don't want the EMS worker or the EMS provider collapsing on your stairs while they're trying to help you. So the goal is to get them into good health by giving them programming so they can reduce blood pressure, so they can lose weight, so that they're at their best in their position. And the last slide, it shows myself and two colleagues. We presented at an APHA conference. They were from Penn State, and it was on an obesity program. The next slide shows publications that I have actually written for Highmark Foundation. And for me, this is one of the most rewarding parts of my position. These programs that we funded all have outcomes, so it requires me doing a lot of background work, research, in order to prepare these particular publications. They're located on the Highmark Foundation website. I really get great satisfaction out of doing these publications. It is a lot of work with grant making and writing the publications, and sometimes RFP all in 1 year. But again, it's very rewarding. I enjoy it, and I get a lot of satisfaction out of it. So hopefully someone will go to the website, take a look at those publications, and be able to use them. So I hope that I've given you a high-level overview. As I said, it's an outlier. Most people don't think about public health and philanthropy, but there is a nice marriage of the two, particularly for the work that I'm doing with the Highmark Foundation. Again, it's working with organizations, it's building relationships, it's actually working sometimes with individuals in those communities to actually help them. Sometimes if a grantee is having a problem with the grant, then I'm the person who works with them. I always tell a grantee I'm your best friend for the length of the program, because I'm the person that they'll be going to for help. So again, I have a long-standing relationship with Pitt Public Health, first as a student, then I was an adjunct professor in VCHS for a time, and as a funder. As a funder, the Highmark Foundation has supported projects in Pitt Public Health. So I'm going to close now. I'd like to leave you with 3 quotes that I have on my desk that I find to be inspirational, and perhaps you will as well. The first quote is, "Make your next move your best move." The second is, "Be yourself. Everyone else is already taken." And the third is, "Your mind is like a parachute. It only works when it's open." So again, thank you for your time, and thank you for having me.